The thorax. Thorax. The thoracic or dorsal vertebrae form the skeletal framework of thorax posteriorly, anteriorly by the sternum, and costal cartilages and the remainder of the circumference, by the ribs. The sternum. The sternum is a flat bone having anterior and posterior surfaces. To it are attached costal cartilages of the ribs. It is divided into 3 parts. The manubrium. It is the uppermost section and articulates with the clavicles at the sternoclavicular joints, and with the first 2 pairs of ribs, i.e., the body. It gives attachment to the ribs, i.e., the exophoid process. It is the tip of the bone. It gives attachment to the diaphragm, muscles of the anterior abdominal wall, and linea alba. The ribs. There are 12 pairs of the ribs. They are attached behind to the thoracic vertebrae. The upper 7 pairs of ribs are attached to sternum anteriorly by means of their costal cartilages, and are known as true ribs. The lower 5 pairs are known as false ribs. The 8th, 9th, and 10th are attached indirectly to the sternum by means of the attachment of their costal cartilages to the rib above. The 2 lowermost pairs of ribs being unattached in front are called floating ribs. The head of the rib articulates with the body of the 2 adjacent thoracic vertebrae, and the tubercle articulates the transverse process of the vertebrae. The first rib does not move during respiration. The space between ribs is occupied by the intercostal muscles. The bones of thorax.